our show, Health and Wellness, Myths and Facts. I'm Gargi Rawat, and today our show is about pre-diabetes. The number of individuals affected by pre-diabetes is increasing rapidly across the world. The presence of pre-diabetes does not mean you have diabetes, but provides you with an option to take corrective action to reverse pre-diabetes and prevent the progression to full-blown type 2 diabetes. Pre-diabetes is a serious health condition, and individuals with pre-diabetes are at high risk of developing full-blown diabetes and its associated complications. A better understanding of this could help with early detection, thereby allow early intervention and potentially lower the number of individuals who go on to develop type 2 diabetes. Getting detected with pre-diabetes provides one with a window to take corrective steps to reverse the condition. You should consult a doctor and follow the doctor's recommendation to make necessary lifestyle changes. There are many myths and queries about pre-diabetes, and today we have with us eminent endocrinologists who can help you understand and manage pre-diabetes better. We're joined by Dr. Abhay Kumar Sahu, Professor in Endocrinology at IMS and SUM Hospital, Bhubaneswar, Dr. Rachna Mazumdar, Endocrinologist, Bellevue Clinic and Fortis Hospitals, Kolkata, and also by Major General Narendra Kotwal. Thank you so much all for joining us on this program to discuss this very important issue. Dr. Sahu, I'd like to start with you. If you could explain to our viewers what is pre-diabetes and how is this different from type 2 diabetes?
Yeah, as the name suggests, pre-diabetes. So it's a condition when the blood glucose is above the normal person, but still the blood glucose not reached in the diabetic level. That means a blood glucose of fasting between 100 to 125 and a postprandial glucose between 140 to 199 is considered as a impaired fasting glucose and impaired glucose tolerance respectively. And both the condition of impaired fasting glucose and impaired glucose tolerance are considered as pre-diabetic state. And this is the state where actually the risk of developing future diabetes is 2 to 4 times higher. So at least you can intervene at this phase so that we can measure give some corrective actions so that you can prevent the future development of diabetes.
Dr. Mazumdar, if you can now explain what is the main cause of pre-diabetes and can it cause serious problems if it's not well managed? We do know that full-blown diabetes, of course, causes major problems, but can pre-diabetes also cause serious problems?
Yes. Pre-diabetes and diabetes is a result of a complex interplay of many dynamic factors. Basically, we have genes on one side and environmental factors on the other. Now, I can explain it better by nature versus nurture theory. By nature, people living in Southeast Asian countries like India, Bangladesh, Sri Lanka, Pakistan, we as genetically individuals, we are more prone to develop diabetes. But our ancestors, they worked in fields, they were farmers, and so because of that hard labor and because they had a very simple diet, they did not develop diabetes to such extent. However, with urbanization and industrialization, and also because of the fact that our diet has undergone a change to a very high calorie, low nutritional value, basically junk foods, and also we have become very sedentary, we hardly exercise, and on top of that we add stress, and tobacco addiction. So here you have epidemic which has been happening for the last 30 to 40 years, and it is not showing any sign of reducing. So basically it is the nature of genetic of diabetes which we are nurturing by leading a very bad lifestyle. However, there is another phenomena which is the current understanding of diabetes and pre-diabetes, that is women who are pregnant, if they are malnourished, then the fetus developing inside the womb has some epigenetic, that is on top of their genes, there are some epigenetic changes. And these children, these fetuses, after they are born, the children, when they grow up, there is a higher incidence of both diabetes, pre-diabetes and cardiovascular disease. So it is also very important to correct the maternal malnutrition during pregnancy. The second part of the question that you asked me is that one should not live in a false sense of security that I have pre-diabetes, I will not develop any complications like cardiovascular disease, stroke, and all-cause mortality, because once it will only occur once I have diabetes. That is not true. Many studies all over the world have shown that pre-diabetes patients have a higher incidence than the normal individuals for stroke by 1.2 relative risk, for cardiovascular disease by 1.3, and all-cause mortality, that is all-cause deaths, also increases by about 1.2.
All right, and let's come to how to detect it, and let's go across now to Major General Kotwal. And if you can tell us how to detect pre-diabetes, is the HbA1c test enough to detect it, or do we also need the FPG test to be diagnosed with pre-diabetes?
Yeah, thank you. HbA1c is a measure of average glycemic control over last 2 to 3 months. Values between 5.7 and 6.4 indicates pre-diabetes. But however, A1C is not standardized across various populations or various laboratories. So it is pertinent to do additional tests like fasting plasma glucose. Fasting plasma glucose between 100 and 125 indicates pre-diabetes. But often one has to do 2-hour plasma glucose during 75 gram of oral glucose tolerance test. And values between 140 and 199 indicate pre-diabetes. And this particular test is more sensitive and correlates well with the various vascular complications. In a patient who has abnormality of fasting plasma glucose and postprandial hyperglycemia, that particular patient is more prone to risk diabetes, almost twice the risk as compared to the individual abnormal value.
All right, Dr. Sahu, what are some of the warning signs of pre-diabetes which can give an indication to a person to get his or her sugar levels checked? And is there also a particular, age that one needs to start being more alert?
Thank you, ma'am. If you see the symptoms of pre-diabetes, probably majority of the patients are asymptomatic. They don't have symptoms and they incidentally get detected during their routine practice. But still there are certain symptoms which warrants the patient to go for blood glucose testing. The most important part is patient usually have sometimes complain of significant weight gain, and also a unexplained weight loss is also another symptom does happen. Patient might develop multiple recurrent skin infections. Sometimes patient develops UTI, urinary tract infections, vulvovaginitis in the female, and also a lot of the time people complain of blurring of vision. So these are the certain symptoms which actually warrants the patient to go for blood glucose testing. And another important group where usually we do is, a lot of people tell that my parents are diabetic, so no, I don't have any symptoms, but whenever I did my blood glucose testing every yearly or every 6 monthly, and I got detected as diabetic. And so when someone will go to visit a doctor, so if someone is having a strong family history of diabetes, after 45 is the general rule, but for particular Asian population, for Indian population, 35 will be actually the rule, after which everybody should go for blood glucose testing. If someone is having hypertension, if someone is having dyslipidemia, these are also group of people, they should do their blood glucose testing frequently so that they can detect pre-diabetic. And another important group is someone is having a gestational diabetes. That means diabetes first time detected during pregnancy and delivered a baby, or delivered a baby of more than 4 kg size or 9 pound size. Probably again these are the group, they should do blood glucose testing, because these are the vulnerable group where actually the blood glucose will be found to be high, or they might detect blood glucose during this testing period. So these are the people who those should go for testing, or pre-diabetes can be detected in those group of patients.
All right, and Dr. Mazumdar, it is generally believed that once you have pre-diabetes, you will definitely get diabetes. But is this actually true, and can pre-diabetes be managed and controlled to reduce the risk of, full-blown diabetes?
It is not right to believe that if I have pre-diabetes, I am going to develop diabetes. That is not true. Older 30% of patients with pre-diabetes go on to develop diabetes. 30% actually revert back to normal, and 30 to 35% remain as pre-diabetes. So there is a hope that if the patients are encouraged to follow a healthy lifestyle and to take the proper corrective measures, one can actually revert or remain in the early or the pre-diabetic stage and not develop full-blown diabetes. That's why before we actually label a patient as pre-diabetes or diabetes, we take care to check the blood values twice, because it has got lots of social stigmatization, then problems for employment, insurance, driving in many countries, as well as there's a lot of mental agony for the patient as well as their family. So, but however, once the diagnosis has been made, we aggressively ask the patient to follow a very good lifestyle, that is weight reduction. If the weight is high, the BMI has to come down to below 23 for South Asians. They should have a separate diet and exercise prescriptions depending on their age, their premorbid, other comorbidities, their preferences, their occupation. So a prescription is not just a list of medicines written down, but there should be a diet prescription as well as an exercise prescription, as well as asking to stop tobacco that intake in all forms, reduce stress, adequate sleep, and other health improving lifestyle measures should be followed. As well as there are some medicines which are approved for patients who are having pre-diabetes. So one should visit a doctor and be on regular medical follow-up.
All right, Dr. Major General Kotwal, now it's a well-known fact that obesity is one of the major risk factors for pre-diabetes, and it was just mentioned earlier in the show that pre-diabetes can also cause weight gain. So if you could tell us more about that, and can you also indicate when should a person start worrying about increasing weight and what steps can be taken to manage it?
Right. Pre-diabetes, as discussed earlier, is an insulin-resistant state. What do I mean by that? That means insulin is there, but it's not able to act. As a result, there is a lot of insulin in the body. This higher concentration of insulin leads to weight gain. Well, if you have pre-diabetes and you are overweight, losing small amount of weight reduces the risk of having diabetes. As far as 1 kg per square meter body surface area increase in BMI leads to 24% increase in risk of diabetes. There are only two ways of losing weight. One is diet, healthy diet. As Dr. Majumdar pointed out, the diet has to be individualized and it should be as per the metabolic requirements and customs. And exercise. Exercise has two important components. Firstly, exercise should be for 30 minutes every day for minimum 5 days a week, and both aerobic and resistance exercises should be done. As far as mantra for losing weight is concerned, one is less eating, but healthy diet and more exercise.
All right, more exercise, and that really is one way to maintain health. Dr. Sahu, can pre-diabetes be controlled and managed without medical treatment? Since it's not, full-blown diabetes, can changing your lifestyle be sufficient to manage pre-diabetes and perhaps, more exercise, etc. in your lifestyle?
Yes. If you'll see how we are going to treat pre-diabetes, probably lifestyle change is the best thing which gives maximum benefit for pre-diabetic groups. If you'll see, as Dr. Kotwal has already discussed, someone has to do exercise, at least 30 to 45 minutes of exercise daily, at least 5 days per week, and no 2 consecutive days should be of exercise. And if someone is going for muscle building exercise, at least 15 to 20 minutes daily or 19 minutes per week, and at least 2 consecutive days should not be of exercise is important. If for diet point of view, a low fat, low carbohydrate, high protein, high fiber diet is utmost important for weight loss, and someone has to lose at least 5 to 10% of their body weight once someone is losing that much, probably pre-diabetes can be revert back to normal. As Dr. Majumdar has already discussed, 30% become normal with particularly some sort of weight loss. So the important part is there are a lot of studies, and the most important one of them is top NIDDM study, where lifestyle was compared with metformin and acarbose. What they found, lifestyle causes maximum reduction in particularly weight loss or maximum reduction in the risk of development of diabetes by 58%. So that shows that yes, lifestyle is the best thing which is important, which actually makes prediabetes to normal. Telling that there are some drugs also has been used for in the prediabetes, like I have discussed, metformin, acarbose. There is a recent study of particularly dapagliflozin particularly in prediabetes groups. Also, orlistat has been also used in the prediabetes groups. But telling that probably no guidelines has recommended use of any drugs in the prediabetic state. So for today's and for by 2022, probably the best thing is the lifestyle for particularly from prediabetes to making a person a normal glucose. Lifestyle is the best thing for those patients.
All right. Well, we'll slip into a short break now, but return with more questions for our doctors on managing pre-diabetes. Stay with us. Welcome back, and today we're discussing pre-diabetes and how to prevent it from developing into full-blown type 2 diabetes. Dr. Majumdar, what type of food groups should one avoid if one has pre-diabetes?
Diet is a major driver for this epidemic of pre-diabetes, diabetes, and cardiovascular disease. So diet is if one thing that should be controlled or corrected to arrest this epidemic is diet. There are some foods which should be avoided, the most important being refined sugars and sugar sweetened beverages, or SSBs as we call them, because that is driving this obesity diabetes epidemic. The second is the refined grains like white rice. Once a grain is refined to remove the germ and the bran, then the glycemic index and the glycemic load of that grain becomes very high. By glycemic index, I mean the rate of rise of blood glucose after taking that cereal. And the glycemic load is the total carbohydrate load of that amount. Because the white rice or the refined grains, they have a higher GI and GL. So the people who eat a lot of white rice, there is a high risk of developing pre-diabetes. The third is red meat and processed meats, meat products, which actually contain some chemicals which are converted into other chemicals by bacteria in our body. In fact, that is the latest explanation of the diabetes development epidemic. It is the change or the gut microbiome that we call. It is the bacteria which is present in our gut, which change these meat products into some chemicals, notably something called TMAO. And these foods, actually, these chemicals cause some inflammation or oxidative stress in the body, which damages the different organs, particularly the heart and the blood vessels, and one develops a stroke as well as diabetes. That is called the inflammation and oxidative stress damaging the body. The fourth thing that we must avoid is high salt intake, that is the sodium, and of course the saturated fats in large amounts, but not just saturated but trans fats. A simple example of trans fats is the same oil which is reused in our homes or sometimes even in the street foods, that converts the oil into trans fats, and it has been found that trans fats cause a lot of damage to our heart. So we should avoid these diets. So what to eat then? instead of refined sugars and refined SSBs, we should drink some fluids which are low in their sugar content. The second is, instead of refined grains, we should take whole grains. By whole grains, I mean brown rice, wheat, oats, which are very low in GI and GL, and that helps in controlling our blood glucose as well as development of prediabetes and diabetes. We should avoid meat and meat products and take a lot of legumes, which is red beans or rajma, then different lentils, that is pulses, and chickpeas, some nuts like almonds, and of course lot of fruits and vegetables. If a diet is converted into this kind of healthy diet, then it helps a lot in improving the insulin sensitivity, which is the main, insulin resistance is the main reason for developing pre-diabetes and type 2 diabetes. So we should actually take this kind of diet in large amounts and do a lot of exercises that will improve our insulin sensitivity and prevent the development of pre-diabetes as well as its progression to proper diabetes.
All right. Well, thanks for that, explanation. And Major General Kotwal, now we spoke about the diet and its role, in our health and pre-diabetes. But what about stress? Can stress increase blood sugar levels and also lead to pre-diabetes?
Stress actually affects various factors like weight, insulin levels, blood sugar, and many more. In stress, what happens is there are things called stress hormones like catecholamines, cortisol. All these hormones are high, which lead to increased insulin resistance and impair the blood sugar. And in stress, often individual resorts to emotional or hedonic eating. Eating more means more weight gain, means worsening of the insulin resistance, and thereby increased risk of diabetes. So it is very important to de-stress yourself. Maybe one can do exercise, which can de-stress you, meditation, breathing, or socialization. Whatever suits you, you must de-stress yourself. And one point I would like to emphasize here, that for de-stressing and generally to decrease the risk of diabetes is eat less, eat healthy diet, exercise more, smile maximally. And for all my countrymen, a message that instead of food snacking, adopt exercise snacking. That means after every 3 to 4 hours, you please exercise for 5 to 10 minutes, any form of exercise, be it stretching, breathing, or any movement that will help to gain positive mental and physical health.
All right, that would be, very helpful and lead to more healthy people if people, instead of snacking, went in for a little, walk or stretching or some kind of exercising. Now, Dr. Sahu, does hot or cold weather also affect blood sugar levels, and can this lead to a misdiagnosis of pre-diabetes, and what can one do in such a case?
Yeah, so weather has a significant role for particularly blood glucose level. So if you'll see, particularly from the diabetes point of view, whenever during the summer season, you will see the blood glucose is well controlled. But as the winter comes, sometimes the blood glucose starts increasing. Also, it has been found HbA1c starts increasing. The reason is, normally during the winter time, normally a lot of the people confine themselves inside the home, and the activity comes down. Also during the home stay, the food intake significantly increases. So the intake of food along with the loss of activities are the two important factors which makes the blood glucose uncontrolled or starts rising during the cold weather time. Another important factor for particularly pre-diabetes point of view, since the activity is coming down, since intake is going up, so probably the body weight also increases that time, and that is one of the important factors for the pre-diabetes point of view. From the diabetes point of view, those who are taking medications, probably again this hot and cold plays a critical role, because like insulin is one of the factor during the hot. If someone is taking insulin during the hot, there occurs vasodilatation, so there occurs a rapid absorption of the glucose or insulin that leads to actually early hypoglycemia. And during winter, there occurs local vasoconstriction. So whatever insulin we are giving, probably it is not going, there will be a uncontrolled blood glucose early. So that happens to the sugar level. But a change in the weather has actually not significant effect during the pre-diabetic phase. So the blood glucose remains almost similar. And so whether someone is during the pre-diabetic phase, whether it is the winter or whether it is the hot season, usually their blood glucose does not changes, but the body weight and also simultaneously the intake of food plays a critical role in the pre-diabetic phase, so that they makes the person to gain some weight, and that is leads to actually development of future diabetes or further increases the level of risk of diabetes in future.
All right. Now, Dr. Mazumdar, in women, is it common to get pre-diabetes during menopause? And if so, why does this happen?
If I can explain it a little more, the female hormones, estrogen, progesterone, which are present during the childbearing age, they are actually anti-insulin in their effects. So that is the reason why the pregnant mothers, they develop diabetes, which is called GDM, as explained by Dr. Kotwal. So once these hormones are reduced in the body at menopause, actually the insulin levels, the requirements come down. So the anti-insulin hormones are reduced in the body. Then why is it that diabetes is often diagnosed at and around menopause? It is suspected that it is probably because it is first is coincidental, because menopause occurs around 45 to 55, and diabetes, the incidence of diabetes is also at 55 to 59 years across the world, although we are seeing it at a much younger age nowadays. So it occurs perimenopausally. Also,
Right.
at this age, women have less exercise, poor diet, and they also it has been found that people who have early menopause, the women, they have 2.4% chance of developing diabetes more than other women.
All right. Well, thank you so much, doctor. And I'm completely out of time, but thank you all, for answering all these very important questions and telling us more about this issue of pre-diabetes and how to manage it. Thank you all for watching. Goodbye.